from Vanderbilt University Medical Center. Thank you to everyone who has called in. We appreciate all of your comments and questions. We do have one more person on the line here. I want to get to him. Michael, thank you for staying on the line. Go ahead with your question.
Yes, hi. My question, you were mentioning the high blood pressure being a risk. What if someone does have high blood pressure on medication and hopefully controlled? Does that matter as far as the risk? Thank you.
Thank you for calling.
Michael, thanks for your question. It's likely, although we don't know for sure, but it's likely that having high blood pressure or diabetes under better control reduces the risk of having adverse outcomes with COVID-19. High blood pressure per se is still a risk factor, whether it's controlled or not, but evidence suggests that people with poorly controlled high blood pressure are more likely to do worse with COVID-19. But I think if you're under the care of a healthcare provider for high blood pressure, definitely it's a good thing for your health that it's under good control, but it's also really important to take that into account when you're assessing risks and benefits about, for example, going out in public and engaging in things that could have some risk associated with them. Make sure you clean your hands to reduce the likelihood of inoculating yourself with the virus through your eyes, nose, or mouth. Keep distance between yourself and others. Wear a cloth mask if you're around others and can't socially distance, and seek medical attention if you're not feeling well.
And we were talking earlier about masks, the mask mandate in effect for Davidson County. There's so many masks out there. Is there a certain kind you should wear? Is one better than the other? What would you recommend as people are looking for these that they need to be wearing as they head out in public?
Yeah, I mean, a lot to unpack there, but the main thing is that we're basically looking for cloth masks that are like a couple of layers of thick t-shirt material. Cotton masks are fine. There are other materials that are acceptable. You don't want to look at them and be able to see right through them like a fishnet or something like that. These really should be pieces of fabric like a thick t-shirt type of thing. They need to be breathable, so they should be comfortable. You should be able to wear them covering your nose and mouth and not have to work to breathe with them on. It's important for people to know that the fabric of a cloth mask absolutely can capture this cloud of respiratory water droplets that comes out of our nose and mouth when we talk or when we're breathing. Those water droplets are actually pretty big and they get caught up in that fabric. But tiny molecules of gas like oxygen or carbon dioxide, they don't get blocked by these cloth masks. So people shouldn't worry about accumulating carbon dioxide in their body or not being able to get oxygen in through their mask. I mean, you could imagine having a mask that's so thick that it's hard to breathe through it. So it's important for people to wear a mask that they can comfortably breathe through. And if somebody has the inability to wear a mask, either their healthcare provider has asked them not to, or it really is uncomfortable and they get anxious or can't breathe through it, then the couple of options are, one, to not put yourself in situations where you may need a mask, and number two, to consider a plastic see-through face shield, one that goes from forehead to below the chin and around the ears. Those are also very effective at blocking the transmission of COVID-19.
All right, I'm going to go back to the phones here. We've got Tiffany. Tiffany, go ahead with your question. You're live on Open Line.
Okay, yes. My question is about the children. Okay, the mayor, when he came through with this mask mandate, he was talking about kids 12 and under don't have to wear them. But when that outbreak came in New York City, a lot of kids got sick and a lot of kids died. Now, Metro schools say when they open up, they want the kids to wear masks too. So how is the mayor going to issue his mandate and then saying that the kids 12 and under don't have to wear them? I feel like he's leaving our kids exposed, and a whole lot of kids are going to be getting sick. Don't nobody have all the answers. This virus is new, and I feel like the mayor is exposing our kids and putting our kids out here to get sick and die. Speak on that, please. Thank you.
Thank you for calling. She was a little hard to hear. I hope you could hear that okay, Dr. Aronoff. Her concerns about children wearing masks, and should they?
Yeah, it's a really, really important question. So, there are some issues with little children. Certainly children under 2 should probably not wear a mask, even under supervision, just because, they may not wear it properly. There's a chance they could put it in their mouth, choke on it, or it could get caught on something and they could get injured. For older children, again, this is going to be somewhat dependent on recommendations from school boards or schools, whether children are asked to wear masks in school, and some of that will likely reflect disease activity. Children are unlikely to get symptomatic from COVID-19, at least a lot less risk for them developing symptoms than adults, and they're less likely to get severely ill, but they could still be part of the chain of transmission of the virus and transmit the virus to a teacher or to somebody else who works at a school. So it can be challenging having a classroom with children all wearing masks, teachers wearing masks, no one being able to read each other's facial expressions very easily. And so that's a bit of a moving guidance as to whether schools are going to require or request masks. And to be honest, I think it's going to depend a little bit on how densely packed the classrooms are, how active the disease is in the community, and whether schools are even allowed to open at full speed. And if they are, masks may be part of the equation there. So I think it's not yet an open answer, but for now, we do know that wearing masks saves lives. It protects against virus transmission.
Okay, we're going to take another short break, and we'll be back with more Open Line right after this. Stay with us.